Good afternoon and welcome to our Friday Clancast, where our experts from DataClan and our friends from time to time come and talk about things that we've discovered, learned, known, and how we might apply that learning in our lives as consultants and mentors and coaches. And today we're focusing on looking after our people, talking about some business and societal trends. And I'm absolutely delighted to have our cultural change, leadership and leadership coach, Claire Murray, with us. So Claire, thank you.
Hello, thank you.
So much has been written and spoken about the importance of employee well-being over the last 18 months. And of course, COVID-19 has perhaps put that to the test a little bit. I wonder whether you could give us a little bit of an introduction to what's been going on and what have you seen in the work that you've been doing?
Thanks, Chris. Yes, employee wellbeing has really shot to the top of the agenda for many organisations over the last 18 months, not least because, of course, COVID-19 crisis is at its heart a people crisis. So it's actually meant that organisations have had to ensure the well-being of their people is a priority. And over the course of the last 18 months, I've run a number of webinars and it's been really interesting, both sort of around the first lockdown, as we came out in the summer and then back into the second and third lockdown. And the webinars were for a number of consulting clients that I work with, drawn from numerous industries across the UK, some global organisations. And it became really clear over the course of the last 18 months that across all industries, that increasingly business leaders were driving employee wellbeing initiatives. And these came in all sorts of shapes and sizes. So, for example, one HR director of an energy company, as we went into the first lockdown, immediately brought in a team of psychologists to help support their employees to deal with this sudden move to working from home and the potential sense of isolation and disconnection that they might feel. So even though a lot of their employees were working from home anyway, this additional pressure, as well as the kind of uncertainty and anxiety around, a global pandemic, which we knew very little about at the time, really helped him drive and very early on this initiative, which was fantastic.
And so, Claire, in those discussions you were having, what came out about what the employees themselves were reporting?
So increasingly, we were seeing a big surge in sort of anxiety and depression and mental health issues linked to a number of things, but all related to the pandemic. So, as I mentioned earlier, the isolation and disconnection that people felt from having to work from home. For some people, this was particularly challenging if they worked in a small space, if they shared a flat. How they got their work done whilst trying to navigate sort of some private space in a shared house. Of course, then you had childcare challenges around homeschooling. So how parents managed to kind of navigate or manage both those issues was really difficult for some. And of course, then the obvious sense of loss and grief that many people were feeling if they'd lost family and friends to COVID, and or not being able to see elderly family members or friends, and they too being isolated. So, and in some instances, one lady who worked in an IT software company reported that actually some of their employees were experiencing sort of something similar to post-traumatic stress symptoms.
So very serious implications of what was going on. And what did you see amongst the managers and leaders in those organizations in terms of how they responded?
Yeah, great question. A mixed response. So some managers obviously stepped up to the plate, and of course maintaining that connection with their employees was really important, particularly those leading teams. So there was quite a sort of a broad span of responses, with some managers and leaders adapting to that and acknowledging that and being aware of the need to keep connected and doing that, so which was great. Other managers weren't or were less aware of the importance of that. So some team members, some employees did feel more disconnected than others. But it also, for example, really raised the issue of mental health and well-being and how important that is in terms of how we work, keeping employees engaged and motivated, making people feel cared and supported, which was really important through particularly the last 18 months. So, for example, in one IT systems organisation, they had a surge of employees who were reporting more anxiety and depression. So the MD took it upon himself to invite all employees to join a video call, where he then disclosed his own troubles with mental health issues in the past, and that had a massive positive impact on employees, in the sense that it meant that they were able to identify with their MD, so that sort of connection was there. But it also meant that actually it was okay to talk about these issues, where in the past, of course, we rarely saw these things mentioned in the workplace, even though there's a growing trend to looking at and addressing employee well-being. The COVID-19 crisis seems to have really accelerated that.
So I think that's really interesting. I mean, it's kind of, I suppose, a role modeling of what the MD wanted to have as good practice amongst presumably all of his people in that case. I just wonder, I mean, it's easy to say things like role modeling, and I'm sure I say things like that without necessarily fully understanding what I actually mean. But I know that you often talk about the importance of trust. How does trust come into the kind of actions that the MD was taking there?
It's a really good question. So if we think about, just for a moment, the climate in organisations when we're thinking about the COVID-19 crisis, and this sense of isolation, disconnection, and how important connection became and still is now, actually. So what we saw was an increasing necessity or increasing demand for colleagues to share more personal information about themselves with their boss, with other people in the organisation. So some of the things that I mentioned, people that have lost family or friends to COVID, so we're dealing with grief, having to work with managing childcare and homeschooling. So, and also because people were working from home, everything went online. So, so there's some really kind of positive, quite comical moments where one HR director said the first thing we did with our video call with our first leadership team, everyone introduced each other to their pets. So, work was coming into the home, work and home becomes much more integrated. So people are bringing more of themselves to work is and bringing more work into the home, which meant that actually you set up a situation where this kind of extra sharing of information, personal information, then creates an expectation that will then continue. And that helps to build trust. So if people feel that they're being heard, that their issues or their challenges are being addressed, or they're able to work more flexibly, that really helps to build a foundation of trust.
Yeah, that's interesting. I remember talking to you, Claire, back in the early days about the studies that showed that in many cases people were unexpectedly more productive working from home. And one of the reasons I remember we speculated a little bit about now, but now it sounds like there's a bit more evidence for, was this idea that you're literally inviting your colleagues into your home. You don't get much more vulnerable and exposed than that. So
exactly.
Interesting.
And that was a real shift as well. And I think I told you I was working with a company in Portugal that I work with every year, coaching some of their leaders. And one gentleman said to me, we went into lockdown, and he said, Claire, all I was doing was checking on my team. And he said, I wasn't getting any of my work done. And he said, I turned to my colleague and said, we've just got to trust them. So I think that, it's changed the relationship that the organisation has with its employees.
It's really interesting. Might be a topic for another day, but that recognition that they had to trust their team. I wonder whether that, that sounds like it came from a good place of realizing that was a good thing, but there's almost a forcing people to trust their people that went on as well. But I wonder, I mean, so we've talked there about organizations, businesses. I wonder whether we can perhaps think about how that might compare and contrast with some of our public services. And I know you have a lot of passion for the NHS.
Yes.
What is it that's going on there, and what's the same and what's different perhaps in what you see?
Well, yeah, great. I mean, like you say, I'm very passionate about the NHS, and it just struck me over the past 18 months, the marked difference between what was happening with sort of private sector employees and business leaders championing, initiating this drive to kind of focus on employee well-being. But at the same time, we were hearing all the way through the pandemic, the growing pressure on NHS and social care staff, which still continues today, as they struggle to sort of tackle these additional challenges posed by COVID-19. And what we see now is unprecedented levels of workplace stress and burnout, as well as levels of anxiety and depression, and even in some cases, instances of PTSD in frontline healthcare staff. And these are the very people who are tasked with looking after the physical and mental health of people in society. So it just struck me, what was different, and what questions could we pose? So, I mean, there are a number of NHS trusts, a simple Google search will show, that are driving employee wellbeing initiatives. But we're still seeing these really unprecedented levels of stress and burnout, and people, more and more healthcare staff leaving their jobs. And also we can see across, mainstream media and also social media, voices of doctors, nurses and other healthcare staff are getting louder and louder in their criticism of political leaders who they believe are not providing the necessary investment and therefore care and support in the NHS and its staff. So yeah,
that's really interesting. To what extent do you think the impact of the style of work that these two groups, NHS and some of the businesses that you talked about, had? I'm thinking particularly, you described the challenge for a lot of businesses was that everything changed for them.
Yeah.
They were suddenly not coming to the office, they were working from home, everything was video conferences and all of these things. And that strikes me as quite different from what went on in the NHS. Of course, lots of things changed in the NHS, and the parts of the NHS that, of course, did almost shut down. I remember, the tragic changes to things like cancer care through the pandemic. But a lot of the frontline staff were being redirected to support this COVID-19 pandemic, still going into the hospital, still doing essentially not dissimilar jobs potentially to the ones they were doing before, but under this intense pressure, lots of unknown and lots of fears potentially. I mean, how would that have played out, do you think, from a psychological perspective?
Yeah, that's a really good point. And actually, if we think about the challenges to both kind of private sector employees and healthcare staff, in a sense, at a very top level, some of the things that were brought about by the pandemic, like, as you said, changes in the way people had to work, additional pressure, a change in the structure of their role, perhaps in more private sector organizations having to adopt, new kind of video, technology that perhaps they hadn't done before. So all of those, the change, the uncertainty, the anxiety, all of those elements are the kind of things that we see when we look at corporate in businesses that are trying to bring about change. So all of the reasons that makes people feel uncomfortable about change was accelerated or exaggerated by the pandemic. But then, of course, with healthcare staff, you've got the additional pressure of saving lives and not being able to save lives. And I imagine that from a psychological perspective, that really takes its toll, especially at the early stages of the pandemic, when we weren't sure, nobody knew really what this virus was, or indeed how to treat it. So it's the unknown that made things very difficult for both private sector and public sector workers. But I think the additional stress on healthcare staff was how to manage this, and the sheer numbers and how they kind of adapted to that.
Yeah, that kind of rings very true, I think, quite intuitively as well. I take my hat off to our doctors and nurses and everybody who kept us going through all of that. Some just amazing stories that I'm sure we're all familiar with. You talked a little bit in the private sector about the role of some of the leaders, MDs, chief execs, senior leaders in these organizations, and what they did in response to their situation they were faced with. And I wonder, how important is it that those leaders at the very top of the organizations take that role in well-being? I mean, is this not something that you could argue all levels of management should be doing, and you don't need that leadership from the top? Or how does that play out?
That's a really good question, Chris. And I think it kind of now takes us into thinking about organisational culture. So the culture of any organisation is effectively set by the very top leadership of that organisation. And we could loosely define organisational culture as the values and the behaviours that people demonstrate in that organisation, and also the values and beliefs of the leaders of that organisation. The processes, so how things get done, are all kind of linked to organisational culture. And also just the day-to-day, how we do what we do and how we interact. And I think, you know, it's really interesting that those business leaders right at the top of the organisation that believe and role model, to use your word from earlier, you know, how important well-being is, that will cascade down through the organisation. And I think, you know, and of course that also influences how the leaders at the very top make decisions about the organisation, about employees. So I think it is important, very important, that the leaders at the very top of any organisation need to believe and value the importance of employee wellbeing, because ultimately it drives engagement, motivation, trust, as we've mentioned before, and that leads to, it impacts the bottom line.
I wonder, what do you see as the balance then? So having established that those senior leaders, the people right at the top, need to set this tone, as it were, what's the balance then? Because I could easily imagine that there's at least two ways that them doing that is going to impact the organization. One is that by them making it a priority, then all of their direct reports, it will be a priority for them as well. There's that natural cascade kind of influence. Whereas if they don't make it a priority, then they're, especially in these times of, you know, strain on resources and struggling to prioritize, anything that your boss doesn't tell you is important is not important. I can understand that kind of management cascade. But also when you describe the MD who shared their own mental health story with all of their staff, I can imagine there's also that kind of leapfrogs the hierarchy, and it tells everybody individually that's important in a way that they then have greater expectations of their immediate management of the importance and how they're going to be treated in this. So it seems to be like there's at least two different things there. I wonder what you see the balance between those and why each is important, perhaps.
Good. Yes, I mean, it's that. I mean, I think, you know, when we're talking about the NHS, for example, I was having a great conversation with a friend and colleague the other day who's a COO of a charity hospital in London. And we were talking about this in wellbeing, and, you know, you can drive initiatives, you can have leaders that are open to valuing and show that they value the importance of employee well-being. But at the very top, you know, if those kinds of values are not translated into behavior or certain decisions, so for example, you know, some people, you could argue that the wellbeing initiatives driven by different NHS trusts are they just simply about helping people manage the status quo? What more needs to be done? If an organisation is over time, investment isn't made in certain areas that are going to support and show support and help people do their job better, then the stress is going to land on the employees. So, and then of course, then we're thinking moving not just into organizational culture, but the structure of the organization. And, you know, I don't know the answers, but one thing that struck me is, well, you know, the NHS is the biggest employer, I think, in the world. David, our resident clinician, would know that. So then one question is, you know, how big, you know, does an organization get too big in order to be able to properly care and support and promote and encourage employee well-being? And thinking about what that means, and how important is it that our political leaders value healthcare and think of healthcare as a right for citizens of society or not?
Yes, David has volunteered that it might be the second largest in the world after the Chinese army, but I haven't verified either of the facts, but it certainly sounds plausible. So I guess that takes me naturally to ask the question, what does this tell us about the type of organisational culture in a post-COVID environment that's going to be necessary for organisational success?
Mm-hmm. Well, what we're seeing more and more now, and actually, you know, these trends were already happening. COVID-19 has accelerated this, and there's a real focus now on collaboration, on connection, on trust, and making employees feel, as I said earlier, cared about and supported. So it's not just about development plans, it's also about physical and mental well-being, psychological well-being. And in a way, it kind of coincides with the kind of global business environment that we're seeing now, where things are much more complex and fast-paced. So businesses, you know, need to be able to adapt quickly. I mean, the pandemic showed us that as well. So, and fundamentally underpinning that is trust. So, you know, business leaders need to be able to trust. They need to get the right information, high quality information from all levels in the organization, which might actually also be about their leadership, and to understand the importance of getting this really critical information from different levels, and encouraging functions, departments to connect, work more closely together, to collaborate in order to as in terms of project teams, all of which require psychological safety, the fundamental basis of which is trust.
I think that it seems that almost everything comes back to trust around these conversations. I just wonder, I mean, so one of the things that I've heard reported secondhand, and I'm always very, very concerned about these kinds of things, but this perception of kind of presenteeism, the idea that if somebody's there with you, it's somehow easier to trust. It might not be expressed as trust, but what would be more commonly said perhaps is it's easy to know that they're doing their job.
Right.
Whereas if they're remote, there seems to be sometimes be a kind of management anxiety that, well, what if they're not doing their job? I just wonder whether you've kind of come across that very much over the last year or two, and what's kind of underpinning that, do you think?
Yes, and the answer to your question is yes, I have seen that, and in fact, you know, going back to what we were saying earlier, that perhaps a lot of employers would never have really contemplated allowing their people to work from home, but of course they had no choice. And contrary to that, the assumption that, oh, if you let people work from home, they get lazy, they don't work, it seemed to have the opposite impact, or the opposite effect, whereby people were finding it hard to switch off. That was partly people, some people have reported that this was partly about missing out that commute time, which was kind of a good boundary between work and home. So you don't have that separation. And as we were saying earlier, work comes into the home. So in fact, it did make people kind of, the presenteeism was, I'm present at my computer. And I'm on all the time. So it was, and I've had a number of coaching conversations with different people over last year where we've had to help, well, I've had to help support them renegotiate their boundaries around work and life. So yeah, that's a really good point.
And do you think that renegotiation is, in terms of the kind of post-COVID world, is that something that's perhaps here with us to stay? I'd like to frame that perhaps in the context of, you know, when we got these things, you know, our mobile phones, we went through this whole thing of, well, you have a work phone and a personal phone for a while, right? And you turned off your work phone when you got home or whatever. And we kind of gradually progressed through to the, you know, companies having to issue edicts about do not send emails at night, sort of thing.
Yeah.
And I wonder, is this a continuation of that? And is it a progression where, particularly if people are working from home, the greater flexibility you get about what the working hours are, which is potentially a benefit, is, you know, counting against that then is this greater expectation that you work all sorts of hours. So whose convenience are the hours chosen at? Is it the worker, or is it the manager, essentially? Where do you see that balance being found, or do you not see it being found? Is this a problem that we're going to be facing for years to come?
I think what I'm starting to see now actually is the challenges are more related to the transition from full home working into a more hybrid type working model. And I think organizations are dealing with that in a very different way. And of course, fundamental to teamwork, to organizational success, is that people are connected and are having conversations and have the chance to build those relationships, which of course, you know, working from home doesn't allow. So I've been speaking to numerous clients over the course of this year, certainly since July when things got lifted, in terms of thinking about how do we manage this hybrid type of working? Do we tell people that they have to come in 1 or 2 days a week? And also we're seeing various kind of individual differences in people's sense of safety and risk appetite, in terms of, particularly I think before the vaccines were rolled out, people feeling less comfortable commuting on public transport. But I think, so that I think is more the challenge that we have now. And it seems to me that people are, or, you know, businesses are, and people are starting to see the importance of getting together. I've run a few team offsites with a digital function in Kingfisher over the last sort of few months, and they've all said how important it was to get together face to face, thinking together, working together as a team, then going out for dinner, relaxing, chatting, sharing personal information, really helps to build that sense of team identity and team spirit and trust. So, you know, I think what we may start to see now is perhaps, you know, organizations reconfiguring their space so that people are doing more individual tasks at home, but really the office is for when we get together, which of course is really, really important. So winning organizations will be the ones that actually manage successfully the collaboration, the communication, and that connection between their employees.
That's really interesting. I want to bring you back to the NHS and a question that David's actually kind of posed that I really appreciate your view on. One of the potential challenges that NHS staff face is that there's a gap between what everybody hears about what's going on in the NHS through news and I guess Facebook and everything else people get their information from, and the reality of what's actually going on in the hospitals and in the health system. And for people working in the system, that discord, that disconnect potentially, and what, you know, whether the fact that, you know, what's going out through the media and the government and all these other challenges, well-meaning or not, it to some extent is irrelevant. There's clearly a gap. And if you're hearing something on the news, and if all of your friends believe one thing, and then you go into work and what you experience is something different,
Mm.
What effect does that have, and what can leaders or organizations do in the face of that kind of challenge, do you think?
I think it rather depends what the disconnect is. So, you know, if I'm hearing that the organisation I'm working for in the media or online or wherever, where, you know, my colleagues, perhaps some I haven't met, are really suffering, and then I go into work, but I don't experience that. It's quite. I'm not quite sure where we would go with that. I suppose what then. Yeah, did David mean the disconnect in terms of, well, actually it's not as bad as people say it is, or
I think he was getting at essentially the idea that COVID is being blamed for everything, but a lot of people in the health system actually kind of know that there's a lot of other things going on that are factors here, whereas it's so simplified and kind of focused, if you like.
And no, that's a really good point. I think COVID has highlighted the pressures and the issues that were, and the challenges that the NHS has been facing for many years. And I think, David's absolutely right. We can't use COVID as to blame the situation, but I think it's highlighted how precarious the NHS is in terms of people, healthcare workers who are able to do the job that they joined the NHS to do, which was to care for patients and help people get better. And of course, if those resources are at their limit, and then you throw in a pandemic, of course, it really exposes the gaps and the chinks and the problems.
So not wanting to oversimplify, but as we're kind of getting close to the end of our time here, you talked earlier about what type of organizational culture is really required in a post-COVID environment, and you came to trust as perhaps the critical factor. If if we've got a leader, a chief executive, a divisional leader listening here, and they're like, well, yeah, of course, I need to build trust in my organization. I suppose there's two questions. One is, should that be my number one priority? Is it really as simple as that's my number one priority? Or is trust just one of perhaps other things that I should be making sure in place from a cultural perspective? Obviously, chief executives are going to have lots of other things to worry about other than just trust, but from a cultural perspective, is trust the number one driver? And what are the kind of top tips? What are the known things that seem to have the greatest efficacy in establishing trust in an organization that the leaders can effect?
And we're talking about both public and private sector organizations?
I think so. I mean, I definitely want to move on in a minute to ask you a little bit about what, because obviously in the public sector we have the political perspective, and I want to come on to that question in a minute. But yes, I mean, certainly from a leadership perspective, public and private.
I think it's more about, it's related to perhaps how the organisation is structured. So if you want to build trust, you need to think about where the connections in that organisation need to be. In the past, many years ago, we worked on sort of hierarchical models. Now we're moving more into what we call a network structure, where it's all about pathways of connection between departments and functions. And it goes back to what I was saying earlier, that increasingly now, collaboration and connection are absolutely critical for organizational success, in order for organizations to keep up with the pace of change and the need to be innovative and adapt and be flexible. And you need to be able to have the right people in place who can manage quite complex relationships, both with internal stakeholders and external stakeholders. So our relationships are getting more complex. And also change is becoming a normative part of organizational life. So in order to help people adopt, feel comfortable with change, lead change, you have to involve everybody who's affected by the change, and that's about trust as well. So it's finding ways for everyone to feel that they've got a voice if things are going to happen to them, but of course it's also about managing that balance between, well, actually, there are some decisions, some things that just have to happen. But it's just making sure you get that balance right. So leaders who are emotionally intelligent, self-aware, can adapt their behavior according to the different stakeholder groups that they are needing to influence is absolutely critical.
Yes, and I see that in almost every organization I go to, manifest in everybody has a hierarchical structure. Yeah. But the number of groups that seem to be popping up that are cross-functional, where there needs to be this effective collaboration to service these needs that just don't sit in a nice little box somewhere.
No, that's right. And I think that's one of the reasons why I developed a strategic relationship model to look at the 4 key elements. So what and how can we, what behaviors do we need to demonstrate to help build these very kind of strong trust-based strategic relationships? So it's about rapport. So that's building trust, empathy, being self-disclosure. It's about respect, so working with a we mindset, so acknowledging the importance of difference. Of course, now that's a really key issue at the moment, because of course the more powerful solutions are drawn from different perspectives and different piece of information. It's about being responsible, so being accountable, owning up to our mistakes, being able to learn from our mistakes, and also reflection. So putting in place these regular review meetings where you sense check how the relationship is working. So it's reviews around relationships and not just about tasks.
Yeah, I think that's very powerful stuff. I remember when I first entered the world of work, one of the things that drove me nuts was this way everything was done by committee, and it seemed to me the only purpose of that was to make sure that nobody had the responsibility.
Yeah.
And it's funny, in a way, there's a degree of that challenge I'm seeing come full circle. So now we don't have the same hierarchies and we have all of these cross-functional groups. I've certainly seen organizations where the actual responsibility and accountability part that you talked about is diluted or lost. Yeah. So you have all of this collaboration that is in practice is going on, yeah, but there's not then the ownership of moving it forwards. It's almost like it's too shared, and people, perhaps because it's more of a network than a hierarchy, are less clear about, actually who is owning this. So I think that's a really interesting area, and I know you've done a lot of work in helping organisations get that balance right and figure out how to do that. So I think the last question is, as we think about that, and you've talked about the NHS in particular and public sector perhaps in general, and we've talked about the private sector and the business world, what lessons do you think that are there for the political leaders in the public sector, in particular, of course, that lessons that they could learn from what's happening in the private sector and business leaders?
Oh, you're taking me, yes, very interesting. I suppose political leaders need to be very clear about what they believe in, so that, I think the NHS now is almost non-political. So, I think it's very clear that it's a very important part of our identity in the UK, but it has been underinvested in for a number of years. So I think it's about being honest, telling the truth. Don't say one thing and do something opposite. We've heard this, walk the talk thing. So and really think about what the employees in a public sector organisation need in order to be able to give the best service to service end users, so patients. I remember a few years ago, my colleague and I, Alison Gill and myself, conducted a piece of research about kindness in leadership. So we interviewed a number of private sector, senior leaders in the private sector and senior leaders in the public sector, including healthcare leaders. Everybody said exactly the same thing in terms of what kindness looks like. So it's about showing empathy, care. And then we asked them what kind of barriers, what are the barriers to kindness? And, certainly from the healthcare perspective in the public sector, it was about well, all of them actually, stress, pressure, lack of resources. So the more stressed your workforce are, the less able they are to give the best service to the people who need it, i.e. the patients. So, and it was interesting actually that the healthcare workers all talked about kindness in relation to the employees of the health service being kind to patients, but they didn't really talk about being kind to each other. So I'm thinking that's shifting now, which is great news, but yeah.
Well, with that, we'll draw this to a close. Thank you so much, Claire. That's been a really interesting discussion. I feel a bit of a Stephen Fry moment coming on. Those who are QI fans will know that QI has a team of elves, and our own Dataplan elves have been scribbling away in the background. And I can confidently tell you that the NHS is in fact the largest employer in the UK. It's eighth largest in the world. David's suggestion of the Chinese army, they come in at third. Okay. Believe it or not. So we got no points in that round.
No, okay.
The Department of Defense of the US, perhaps unsurprisingly, is actually the largest employer in the world. And so with that, we'll finish up for today. Hopefully, everybody will be able to join us next time. So 2 weeks from now, Friday, the 17th of December, when we'll be having the Dataplan Christmas quiz. So as you were just saying, Claire, it's part of our efforts to de-stress, have a bit of fun. And if it's anything like the Easter quiz we did, I can guarantee it will be nothing if not enlightening for everyone. So hopefully we'll see you all then. So for now, it's just a case of me thanking Claire and wishing everybody a great weekend, and we'll see you next time. Thank you.